According to the Canadian Mental Health Association, 20% of Canadians will personally experience a mental illness in their lifetime. This includes conditions such as depression, anxiety disorders, schizophrenia, and more. Currently, suicide accounts for 24% of all deaths among 15 to 24-year-olds. Recently, a number of organizations have made efforts to dissipate the stigma surrounding mental health issues, such as the Bell Let's Talk initiative. While raising awareness is an essential step in the process, we still have some major roadblocks ahead of us. In 2012, Stats Canada ran a survey of over 25,000 Canadians to determine whether or not their needs were being met with respect to mental health care. According to the report, of Canadians who felt that they had a mental health need during 2012, only 67% felt that their needs were met. These needs include medication, information regarding mental health, and counseling. Of these needs, the least likely to be met was counseling, and this is a big issue for several reasons. While medication is an easy solution for some people, for others it isn't so simple. Mental health medication can have severe side effects, and individuals will often have to try several different medications until they find one that is right for them. Additionally, mental health medication is frequently expensive and may not be covered under Canada's Health Care Act. Now, I mentioned before that Canadians feel their counseling needs are unmet. This is primarily because of the lack of mental health practitioners in Canada. Appointments with such professionals often involve months of waiting, which is a significant issue for individuals with pressing mental health needs. However, there are very effective counseling techniques to remedy mental illness. A type of psychiatric therapy called cognitive behavioral therapy, or CBT, has been proven to be as effective as medication for some conditions. So what exactly is the problem that we have identified thus far? Well, we've established that Canadians with mental health needs are not having their needs met. Also, medication isn't a viable solution for many people, and there is a shortage of mental health care practitioners who can provide effective counseling to Canadians. The solution I propose is to foster a community-oriented approach to treating mental health. Our society is currently working through the process of dispelling the stigmas associated with mental illnesses. This is a fantastic start, and what I aim to do with this proposition is to lay the foundation for our next steps. Presently, there are two primary methods of cognitive behavioral therapy. The first is high-intensity CBT, which involves one-on-one sessions with a trained therapist. The second is low-intensity CBT, which is a self-help approach. While the high-intensity method yields more persistent results, it is not readily available to all Canadians due to the lack of mental health practitioners. The weakness of the low-intensity method is the lack of accountability and feedback. In order to provide cognitive behavioral therapy to more Canadians suffering from mental illness, we need to develop an approach to CBT that lies between the high-intensity method and the low-intensity method. Now, the model for moderate-intensity CBT is currently non-existent, but I'll try to paint a picture of what it looks like. The underlying idea is to include loved ones in the process. Given that medical issues are typically seen as a private matter, these individuals may not realize that they can play an integral part in the recovery process. By providing information and condensed training in cognitive behavioral therapy, these individuals will become equipped to aid their loved ones suffering from mental illness. They can help them develop a plan related to CBT, provide frequent feedback, and be available for support much more readily than a practitioner can. Now, I'm not a psychologist, so I can't comment on specific details of a model for moderate-intensity cognitive behavioral therapy. The main point, however, is to introduce the concept of a community-driven recovery effort. As we dispel the stigmas associated with mental health, the next step is to start addressing it as an issue for all Canadians, not just for individuals who suffer from mental illness. Only then can we begin to work towards recovery together, to help those who need a little help getting back on their feet. Thank you.